everyone. My name is Jason Mantzoukas, and I am thrilled to be back with Dr. Kiami Mahania, practicing physician and CEO of the Lynn Community Health Center in Lynn, Massachusetts. In 2022, we are celebrating our 50th plus one anniversary, and this is part of a series of videos to celebrate the significance and impact of this organization. If you're wondering why that actor from The Good Place or Brooklyn Nine-Nine is appearing in a video series about the Lynn Community Health Center, there's an answer. My father, Bill Mantzoukas, was one of the founders of the Lynn Community Health Center in 1971 and served as its first executive director. So I'm thrilled to be here having these conversations with Kiami. Kiami, how are you?
I'm doing well, Jason. We're sort of in the same age category. We do vastly different things. And yet you had your father as this sort of father figure, and I have him now as this mentor and coach.
Yeah, no, it's absolutely. We are both in many ways influenced by the same man, by the same father figure, which is, makes us, I guess, brothers in a way, competing for our father's love.
There you go.
So, Kiami, what I'd love to talk to you about right now, and the kind of focus of this video, is the opioid addiction crisis. What kind of substance use disorder services do you offer at the Lynn Community Health Center?
You introduced me as a practicing physician. So I take care of patients who are all over that sort of spectrum of recovery, from actively using to sober times 20 years. It used to be mainly a first world problem, meaning we saw it a lot in the US and in Europe. But now really it's gone to middle income countries, places like Mexico, Brazil, or Russia are really suffering from this opioid addiction. And then also in poorer countries. So places like Kenya, Tanzania, Afghanistan are really seeing this explosion. And the US has not been immune to that.
Sure.
And Lynn in particular has had this huge explosion.
I'm curious, how did the Lynn Community Health Center start offering services for people having substance use disorder?
Now, the health center that was started as a mental health center, the idea of treating trauma and treating pain has always been at the center of what we do. And substance use disorder was really seen as another source of trauma. So the Lynn Community Health Center has been treating substance use disorder since its inception, long before it actually had this sort of name and this recognition. Because we have this wide spectrum of mental health therapy, we have this wide spectrum of substance use disorder services. It melds pharmacology with clinical and mental health therapies. And we've always offered that care. What's really happened over the decades is that it's grown in size, and it's also grown in terms of how society looks at it. Since the 20s and 30s, substance use disorder has been seen as a sort of moral failure, and then it morphed into a legal and a criminal issue. And it's really taken us almost 100 years to accept the science of the fact that addiction is actually a disease.
So how are you reaching those people who are struggling with addiction and who need these services that the Lynn Community Health Center provides?
So although it's clear that it is an issue that the whole community benefits from, there are clearly pockets of the community that need these services more than others. So 50 years ago, it was mostly a male problem, whereas now it's pretty equal women to men. So we also need programs that are made to be accessible to women and to people of color, and particularly to people who prefer to be served in a language other than English. It is a constant struggle, which is how do you reach people who, by very definition, feel that society has either shunned them or discriminated against them in some ways? How do you reassure them that we will not contribute more to their pain, but that we will actually help them deal with their pain?
I'm wondering if you can tell me a little bit about the peer recovery coaches on your staff. How do those positions work with the whole care team?
These are generally people with lived experience, meaning that at some point in their lives, they themselves were using drugs, and now they're sober. And so they bring a kind of knowledge and emotional intelligence and ability to relate that nobody else in the team can really duplicate. And they become essentially the main member, the most important member of the team that the patient is turning to. We are able to provide better services and longer services when peer recovery coaches are involved.
I'd love for you to break down for me, what is the Moms Do Care program?
It's a program that was started as part of a grant. From a patient's perspective, is that you show up pregnant, you get taken care of by this team during the pregnancy. It's the same team that goes with you to the hospital to deliver your baby. It's the same team that takes care of your baby and you while you're in the hospital. And it's the same team that then takes care of you when you come out of the hospital. So that means that for an illness that is really defined by the stigma and by the difficulty that patients experience to reveal this kind of stigma, to have just this one team, so you tell your story once, and then that's it. You're set for 5-10 years. And it's the same team that's caring for you that gets to know you at a deeper social justice level. What we're really trying to figure out is, okay, if someone is using today, what does it take so that in 5 years, when the kid shows up to kindergarten, that kid is well balanced, has a great mom, has great family support, and is ready for kindergarten? Like, what does it take? What kind of services do you need to put in place before the child is born in order for that to happen?
So the services we offer at Lynn Community Health Center as a whole also include the services we provide on the Orange team. We offer primary care and substance use disorder treatment. We offer low barrier access to treatment with a no wrong door policy. A patient might come and present on Orange team. We will get them on medication, stabilize them a little bit, and then we'll connect them with a primary care doctor on an integrated primary care team. So Lynn Community Health Center has a no wrong door policy where a patient presenting for treatment can access care no matter where they come, whether that be urgent care, their primary care doctor, walking into the Orange team, or they call and speak to a triage nurse. Wherever they present asking for help in the moment, they're able to be connected with services. We want to meet patients where they're at, providing compassionate care.
One of the reasons that I am so committed to continuing to work at LCHC is that we have such a wonderful obstetric service. It's multidisciplinary. We have family physicians, OBGYNs, and nurse midwives. We truly work collaboratively and work to build consensus about how we care for patients. That has meant that as a family doctor, all in one place, in one exam room, I can see a pregnant woman, do her prenatal care, assess her addiction, discuss treatment with her, and then postnatally, I can provide the pediatric care for her child and do that all at the same time and in the same place, and then be connected to, on our team, mental health professionals, case management professionals who are also focused on that population.
So I work on the Sunflower team on the Moms Do Care grant, and the Sunflower team Moms Do Care grant allows us to especially focus on moms, so either pregnant, postpartum, or moms who have a child under 3 years old and also have a substance use disorder. So I think our program is really special because of the peer support aspect. I think, some other parts of my job are being able to bring the patient voice into our team meetings or our case discussions and really sort of make sure that we're being as trauma informed as we can as a team. There's a recovery orientation to the whole system. I became a recovery coach because of the care that I got here at Lynn Community Health Center. So I have a daughter, she's 6, and I have twin boys who are 3 years old. And my daughter, I really struggled through that pregnancy. I also have a substance use disorder. I'm in recovery, and really just met with compassion and kindness every time I walked into the door. I saw one of the doctors that I had seen during my pregnancy with my daughter, and she told me about this really cool thing they were doing across the street called Moms Do Care, and they were looking for a peer mom with experience with a substance use disorder and experience being a mom. We're in the community, our faces are out there, people know, oh yeah, I can call Tisha and she can get me in with a doctor, or she can get me in with a nurse. And so constantly linking people to services is something that I think people should know that recovery coaches are doing. Where I'm visiting people in hospital rooms, in labor, and and things like that, and we're visiting people at the shelter, at our local syringe exchange. We're boots on the ground in the community, and I think that's so important to this work. Most of our moms have housing insecurity, so they're either in a shelter situation or they're staying with friends or family, and it's just not a stable place. a lot of times that will lead to a more in-depth investigation from the Department of Children and Families.
The big COVID silver lining that we've experienced is the ability to do phone visits. That has been a tremendously wonderful change in my practice over the last 2 years, that when I think it's clinically safe and important to do so, I'm able to talk to a patient via the phone, prescribe them buprenorphine to get started on. And it has just really lowered the threshold for care.
We on Orange Team remained open the entire time. So we were able to offer injectable medications, and we were open for sort of high-risk patients when they needed. However, most of our visits did get shifted to telemedicine, and we are still able to offer services same day for patients who are interested in care.
So when you add on a pandemic, I think it just enhances that isolation. And so really just feeling like you are alone. And that oftentimes can make somebody have a return to use. Part of being a recovery coach is being sort of that model, that sort of guiding light for somebody in their recovery journey. And I know when I was actively using substances, I didn't know that recovery was possible. I didn't know that people stopped using substances and went on to lead a fulfilling life. Something that I would love the audience to know about moms who do struggle with a substance use disorder or do struggle to enter and stay in recovery is that both instincts are really, really strong, right? So I struggle all the time with having this huge identity of being a mom and having this huge identity of being a person in recovery, because they have competing interests sometimes. Something I would love for people to know about moms in recovery is just the incredible strength it takes to be a mom and be in recovery and balance these two really huge identities. There's this stigma about substance use disorder, but I think that stigma is only enhanced when you're talking about people who are pregnant and have a substance use disorder and are actively using. So did you just choose drugs over your child when you were using, while you were pregnant? But I think that something the medical community has come to understand is that substance use disorder is a disease and it needs treatment, right? And it's not something that somebody controls.
Moms Do Care funding is very generous for the healthcare team, like supporting our staffing, but it's not designed to provide material supports for individual patient families.
So if we had unlimited funding,
Well, if I had an unlimited source of money, I would add housing resources.
having housing,
That is definitely something that our moms struggle with.
And for food.
full staffing, wraparound services for all patients, intensive case management, peer recovery support.
I would just enhance in-person programming.
Wish list items might include a drop-in center where people can engage in services, maybe have some coffee, hang out, and have a safe place to go.
Increase funding for more material things. A lot of our moms struggle with food insecurity.
Patients can respectfully shop for donations and things that they need. Patients often come in without a lot of things.
Just struggling with getting material things like hygiene products or feminine hygiene products.
Things like that would be are really important.
And so we very regularly are having to creatively look around the community for donations for baby supplies, for diapers, particularly for maternity clothes and other supplies for moms. Moms Do Care really upped the ante on that because it insisted you need to have this person with lived experience who has this voice at that table. And then by having that person and a nurse case manager and a community health worker, you're expanding the bounds of what the care looks like. And now that I've seen what that adequate care looks like, I want that for all of my patients. That's really consistent with the history of community health centers. There's the apocryphal story about community health center founders insisting on having rocking chairs on the front porch of the health center so that moms could rock their babies, and that was part of the care. People saying, you can't give prescriptions for food, and the founders of the community health center movement saying, the last time I checked, this treatment for malnutrition is food, so let me prescribe that. And I think this is really an extension of that.
We love what we do and we'd love to take care of more patients. We have the capacity to do so. We just need to sort of know the people that we're here for them.
You have all of these elements that assembled in different ways can be used to such effect, for different needs.
I think that comes from the fact that we're starting from a point of being a community health center. And so it's just great to be able to be part of an institution where, yes, we have to be financially viable, meaning that we want to make sure that everybody gets paid. But the fact that we're not focused on making money, but we're focused on fulfilling a community need means that programs like this have a chance to emerge. Is how can we take 1 + 1 + 1 and have it equal 7 instead of 3, which is what happened in this case.
So what do you need in order to keep being able to provide these services?
It relies on the greater society not losing interest in providing the institutional supports for our most vulnerable patients. It relies on government at the state, federal, local level to keep being interested, to keep thinking of these patients as us and not them.
If you're watching this video at home and would like to learn more about the Lynn Community Health Center and how to support it, what it does, please visit their website, which you can see on screen here now, but is also lchcnet.org/donate. You can learn more and you can help support this absolutely vital organization in the community. Kiami, thank you so much for making the time to talk to me today about the substance use disorder programs at the Lynn Community Health Center.
Jason, as usual, thank you for the generous time that you've given this. I know it's near and dear to you through the connection through your father, but I know that you've been incredibly busy, and it's always such a pleasure and such a joy to be able to share these moments with you.
I'm out in the street, I'm walking around. Sometimes people recognize me from Brooklyn Nine-Nine or sometimes from, The Good Place. But, more often than not, now they're pointing at me and they're screaming, Lynn Community Health Center! Yeah, Lynn Community Health Center!